Hi, I'm Steve Towns, Deputy Chief Content Officer for eRepublic. Welcome to our Q&A with Denise Winkler from Google Cloud. Denise is Strategic Business Executive for Social Services and Labor with the company, and she has more than 20 years of hands-on experience in the health, human services, and labor field. She got her start as an entry-level worker in an HHS agency. She's been a senior administrator. She's also been an advising consultant to state and federal agencies across the US. With Google Cloud, Denise serves as a subject matter expert and strategic advisor on current trends and issues, especially on the role technology can play in improving citizen outcomes. So, Denise, thanks for joining us today. There's so much going on in this space. It's really nice to get a chance to talk to you about what you're seeing and where things are going.
Thanks for having me, Steve, and thanks everyone for listening in. We hope it's an informative conversation.
So Denise, let's dive into a few questions. I think my first question is, how has the pandemic affected technology investments for social services and labor agencies?
Well, social service and labor are part of sort of that social safety net ecosystem. And when COVID hit last year and we started to implement public health measures to control the spread, with lockdowns and social distancing and so on, unemployment absolutely exploded. Um, the last week in March in 2020, unemployment was, for a single week, we had 6.9 million citizens file first-time applications for unemployment. And we've seen more than 700,000 individuals apply for unemployment every week for almost 50 weeks in a row. We've never in our history had that many people in a single week apply for unemployment. So what happened is, as this drastic increase in need for social service and labor benefits, and we had these social distancing and public health measures, the ecosystem had to send citizens to their portals and call centers to be able to apply or get benefits. And unfortunately, most of that IT infrastructure was legacy. It couldn't easily be changed, and it was never designed to handle that kind of volume. So what we had were people waiting hours on the phone, portals going down. We also ended up with a lot of bad actors, unfortunately, coming after that money, with that much money being pumped into the system. And so, unfortunately, we had a tremendous amount of volume slam right up against older on-prem legacy systems that simply were not designed. And they also couldn't quickly be changed to accommodate the new legislation or the new benefits, because every time a new relief package came out, there was a new benefit program or there were changes in existing benefit programs. So that's sort of that kind of sets the table. And so how that influenced investments is, it really showed the power of cloud in this past year, especially Google Cloud and Google Cloud technology. Being able to handle literally petabytes of data on demand enabled agencies to be able to handle that massive fluctuation in volume. Being able to use a low-code, no-code platform to stand up an application quickly for a new benefit program and to put it in the cloud. Using things like new innovative technology that typically hadn't necessarily gotten a foothold in social services and labor, things like artificial intelligence as a way to automate routine tasks and questions through intelligent agents and chatbots that helped agencies be able to deal with all of this volume. And then things like using that same innovative technology to automate finding errors and potential fraud in transactions. But more importantly than identifying the errors and the fraud, which is important, I don't mean to say that it isn't, but really what it was able to do was separate those transactions from the claims and applications of citizens who were legitimately eligible for those benefits, and run through those quickly so they didn't get stuck in that like gigantic job jar. They could be peeled off and paid. So I think ultimately how it's going to impact investments moving forward is that states, counties, cities, the entire social services ecosystem or social safety net ecosystem is going to start looking at cloud technology, moving things to the cloud, looking at and using the innovative technologies like AI and machine learning, and actually automation of those high volume, low touch types of transactions, I think is going to be what we will see in the future.
Yeah, really interesting. So cloud, I mean, really gave the scalability and the flexibility, but also that front door into innovation and leveraging some of those new capabilities in interesting ways.
Absolutely.
Denise, talk about how service delivery itself was reshaped by the pandemic. I mean, really the way safety net agencies engage their clients and deliver services had to change rapidly, right?
Well, it literally had to change overnight. The social distancing and public health measures that were put in place, there was no in-person service delivery, which for the social safety net ecosystem, which is largely government and public sector, that particular segment of that particular industry segment literally has always been driven by in-person, face-to-face delivery for the most part. So I think the ways that it changed, and it changed actually for the better, I think, in many ways. Being able to do virtual interviews, being able to submit applications online, being able to submit verification documents for those applications online, actually improves access and really improves citizen services when the technology can support the volume necessary. It also is more efficient, frankly, for government agencies and community providers to be able to do that, to be able to do those activities virtually. It takes out travel time and all sorts of things. And it also improved access. It improves citizen access. If you think about using things like intelligent agents and chatbots, typically these organizations have call centers available during normal business hours, or maybe they might have extended hours on one night a week or something of that sort. By being able to put that type of technology in place, not only do we enable consistent responses to those frequently asked questions or those very repetitive tasks, but you expand that access to 24/7. You can get response from an intelligent agent or a chatbot after hours. Also being able to dial into a portal to check the status of your application. You don't have to call in to do that during normal business hours. You can do that 24/7. So I think what it has shown us is the power of being able to do that, the efficiency, the fact that it does work. And it had to happen so fast that I think everyone was truly shocked that yes, it wasn't without its hiccups, but once agencies were able to enable that virtual workforce, which was also a huge change, many of the staff in these agencies had really never worked virtually. So I think it's again, it hasn't been without its hiccups and struggles, but I think it's really proved how successful and how much more access it provides.
Yeah. So you're touching a little bit on that on our next question, which really does talk about, I mean, some of the lessons agencies have learned around delivering services more equity kind of going forward. I mean, there sounds like there's a huge opportunity there.
Well, there certainly is. I think that, again, if you think about this, uh, many safety net organizations are there to help people who have fallen on difficult times. Um, so asking someone to leave work to come in for an interview doesn't really make it sort of counterintuitive to the outcomes of many of these programs. But also being able to provide that expanded access is really important because it enables people to actually apply, um, but also the access for using translation, being able to support folks in multiple languages, being able to support individuals with disabilities. All of those things can be done virtually. Also, serving people who don't have a ready access maybe to transportation. Um, uh, it could take 2 hours to take a bus. If you live in a large metropolitan area, you can be on a bus for 2 hours to get to an office. I also think, though, the interesting thing is it's also exposed some of our weaknesses and vulnerabilities, such as broadband access, right? Does everyone have broadband access? Does everyone have access to some type of digital device to be able to do business digitally? And it's also reinforced within the technology world that all of these programs, these access programs, have to be able to work with multiple devices just as well as they would work with a computer. They have to be able to work with a phone. We think that's table stakes, but it's not always table stakes.
So really interesting. You've done this work, in the past and worked with clients. Talk about, I mean, we've talked a lot about the advantages of doing these new kind of virtual services. Um, how should agencies be thinking as we kind of move into recovery and hopefully, into whatever normal is going to be? How do agencies think about balancing, in-person services now with these new digital options? Because it seems like there's going to be both in the right places.
Well, it's interesting. I think virtual service delivery is extraordinary. I do think it expands access to it expands access not only in time but to maybe hard to serve populations, people who have access. But also at the same time, I'll focus on maybe a specific program, for example. In child welfare, for example, prior to COVID, child welfare workers had to have face-to-face visits. Virtual visits really were not allowed. In child welfare, nothing is ever going to replace that face-to-face engagement with a child and family. But I think moving forward, what it can do is expand the frequency with which we could engage with a child and family. So I think it's a balance of what is the policy and outcome versus what is the task we need to accomplish. I think that's where the balance is going to be. But I also think that we can look at innovative ways to help us recover. For example, virtual career centers. We need to get a lot of people back to work. But let's face it, certain industries are not going to recover as fast as other industries. For example, leisure and entertainment, hospitality, those industries have been hit much harder than say the technology sector has been hit. And so using something like a modern virtual career center where you have employers who can post jobs and you have citizens who can post their resumes and their skills, and to use innovative technology like artificial intelligence to help map the skills that this person has, maybe not just to job openings, but to jobs that are maybe in another field that is recovering faster. We might be able to get that individual back to work faster by using those kinds of technologies, and doing things like supporting virtual career fairs, virtual interviews, those kinds of things, all in one place. And if those types of solutions are actually plugged into programs like, for example, SNAP employment and training or workforce development employment and training agencies, they can funnel their individuals and not only help them get back to work, but also be able to monitor compliance with certain program requirements, those kinds of things. I think we have to start to think about how do we use technology to actually help us open and recover more rapidly, but never forget that there are humans in the system.
Yeah, that makes a lot of sense. Talk about, I mean, we've talked about how sweeping these changes are, how rapidly these changes came upon us, and ultimately how it kind of, I think, accelerated some really good trends coming out of this. Maybe talk a little bit about how the changes we've been discussing transform experience for both the caseworkers and employees delivering these kind of services and the clients who are receiving, the social safety net benefits that they really need.
Well, you're right. This hasn't been just transformative for citizens and constituents. It's been equally transforming um, for the staff that work in these agencies. Um, I think the ability to be able to serve people where they are, in my years of experience working in organizations within that social safety net ecosystem, staff come to work there because they really want to help people. That's why they started to go to work there. The ability to help more people more effectively and to do it virtually. They can see, because they're not traveling and they're not doing those things, they can expand the ability to serve individuals. But I also think it's really important that one of the innovations that's come out of this is to look at process automation, task automation. Why in the world do I really want to spend hours a day scanning verification documents? That's not really fun for a lot of people. So being able to automate rather routine tasks enable staff to be able to focus on more complex issues, or be able to spend more time working face to face, whether that face to face is virtual or literally face to face. It allows more time to do that. I think that's going to improve not only the efficiency from the agency's perspective, but the job satisfaction. Also, being able to work with modern tools makes it modern, more user intuitive tools make it easier and more satisfying than working with some of these very older legacy systems that don't have the features and functions that are needed. And also from an administrative perspective, using the power of data, being able to aggregate data and being able to look across the population of people you serve and be able to track outcomes and make policy and process decisions that are data driven, it's very satisfying when those outcome measures tick up.
Yeah.
It really is. So I think those are some of the important things.
Yeah. So maybe our last question is around maybe your thoughts on best practices. I mean, as we move into recovery and we kind of look at these changes that have been made, and with an eye toward improving those outcomes and serving those constituents better, and using those dollars smarter. What best practices would you point to for social safety net agencies to kind of, be thinking about it as we hopefully enter a new phase?
Well, I think it's a couple of things. I think that cloud has really shown its power and effectiveness and efficiency in the face of COVID. So certainly looking at moving away from the traditional architectures toward a more modern cloud-based architecture is really critical. Doing that modernization of those systems with an eye to cloud and to cloud technology is absolutely critical. Part of the reason it was so difficult was we've stuck with this traditional infrastructure for a very long time because it's been easier to do that in the public sector procurement space. It's been easier. So looking at that cloud modernization is absolutely a best practice. I also think that as states and cities and counties look at modernizing, one of the things that we've also demonstrated during COVID is the ability to do that incrementally. The days of ripping and replacing all of these big benefit delivery systems and taking 3 and 4 and 5 years to put something new in, that just isn't, it's been a recipe for disaster. Being able to address mission critical problems with modules that work and being able to implement those in days and weeks, not months and years, has really proven itself. And that is, I believe, a roadmap for the future in how we can modernize these systems so that and I hope it never happens again, but we know we will see spikes in need again in our lifetime, and being able to have the systems in place that are flexible enough to address those needs is critical. But I also think, again, from Google's perspective, data is so important, and making, our mission is to organize the world's data and make it useful. Organizing data and doing and having the data in order to make the policy decisions and even the practice decisions, the service decisions, the tactical, for whether it's a caseworker to a supervisor to an administrator, all the way up to governors and to the federal agencies. Being able to have data that's useful, that helps you make good decisions and gives you insight into your programs is critical. And then again, I think virtual service delivery it may have been forced upon us, but I think it's been a blessing in the sense that it's going to enable us to use dollars and resources much more effectively, while at the same time providing a much better experience for our constituents, and also be able to give them the benefits that they qualify for and they need, so that it improves our communities and our economy and gets us back on our feet.
Yeah. Denise, really appreciate you spending some time with us. Like you said, I mean, there's so much need, but so much big opportunities to do good things in this space. Fascinating discussion. Thanks for being here.
Oh gosh, thank you for having me.